Nearly 40 million Americans have diabetes, and about half will develop diabetic retinopathy, the leading cause of irreversible blindness in working age adults. Here to discuss how people with diabetes can protect their vision, when to see a retina specialist, and what new treatments are improving outcomes for patients is Dr. Jeffrey Emerson, President, American Society of Retina Specialists. Good to see you, Doctor. Thank you for joining us this morning.
Thank you.
So, doctor, what is a diabetic retinopathy, and why is it such a concern for people with diabetes?
Diabetes damages the retina. The retina is a delicate, important part of the retina at the back. And when it gets injured, it results in blurred vision or blindness. About 10 million Americans have diabetic retinopathy. Almost half of people with diabetes will get diabetic retinopathy. We want to detect it early so we can prevent the vision loss.
So how can early detection prevent vision loss?
In the beginning of diabetic retinopathy, there really are no symptoms. So you don't really know you have it until significant damage is done. It's hard to know. So really what's important is to get a dilated eye exam. If you have diabetes and can't remember your last diabetic eye exam, you should get one. And if you're starting to get symptoms like blurred vision or difficulty reading or floaters or shadows in the vision, then you should see a retina specialist. Retina specialists have advanced imaging so they can evaluate diabetic retinopathy. They know the options, and as retina specialists, we can get you going on treatment.
Well, speaking of, what new treatments and technologies are helping patients see longer?
Thanks to research, there's a lot of great treatments. They fall into three main categories. There are eye injections where we put medicine into the eye. This medicine can help diabetic vessels work better. There's also laser treatment, and there's surgery. But most diabetic patients are on eye injections, and they get those eye injections every 1 or 2 months. I have a number of patients who are in clinical trials looking at longer lasting medicines so that hopefully patients will be able to come in every 3 or 4 or 5 months instead. And there's even newer medicines and treatments that are also in trials, like gene therapy or implants.
Well, technology is amazing. You know, and if somebody's watching with diabetes, what is a retina specialist, and why should somebody with diabetes seek one out?
A retina specialist is more than just an eye doctor. We are physicians who have almost 10 years of advanced medical training specific to the retina. That is the treatment, the diagnosis, and the surgery. We are the experts who are most suited to taking care of diabetic retinopathy. A lot of diabetic patients also have an endocrinologist or somebody else to help with diabetes control, but it's the retina specialist who helps the most with vision loss and diabetic retinopathy.
So then how can somebody in our area find a retina specialist, you know, that's close to them?
It's easy. On our website, findyourretinaspecialist.org, you can type in your zip code or look up a doctor. It's easy.
That's fantastic. Is that where people should go to learn more information about everything you talked about today?
There's another tool on the website that's seeforalifetime.org, and that has lots of great information.
Well, doctor, thank you so much for your expertise, and thank you for bringing light to the situation that I didn't even know anything about. So it's going to help a lot of people in our area with diabetes. So thank you so much for your time.
Thank you.